Good morning, everyone. Thank you so much for joining us. My name's Tom Scott. I'm a product manager at Modality Systems. I'll be hosting the webinar today. And we will get started right away, just because there's a lot of content, a lot of great speakers here today, and really want to get through this and hopefully not overrun too much for you. So there will be a recording of this webinar going out for anybody that can't make it. So hello to everybody listening on a pre-recorded version. And also the slides from all of the presentations today will be sent out as well following this, this webinar. I will just run through the agenda and give a quick introduction to the webinar. So the webinar is entitled How to Realize the Potential of Microsoft Teams in Healthcare. I think we're all agreed that in the current situation, due to circumstances that I think nobody would wish upon anybody, and being forced to work remotely, then the adoption of Teams has accelerated massively. It's providing amazing benefits for people to work remotely, particularly in healthcare, to deliver virtual consultations, to keep in touch with patients, to keep in touch with their colleagues, and continue to work and function when working remotely, and really trying to avoid and work to the social distancing restrictions that are imposed on us. The webinar today is really to take that a bit further and see, along with that, how can you realize the potential and what other areas, and we can explore some other areas and potential challenges that you may see along the road as the Teams deployment grows, as we all want it to, and also how it's going to, how we can look to cement and further build on the great work that's been done already to cope with these challenges. And really try to cement Teams in your organization and get that adoption up as much as possible. To run through the quick agenda and some housekeeping, quick welcome from me. Then my colleague Gavin Dyer, who is our account manager for healthcare at Modality, will run through an introduction to Modality, what we do, and a bit about the company. We've got Keith Hanna from Microsoft, who's going to talk about Office 365 in healthcare, features that are coming in Teams, and also use cases, integrations, various options, and really dive in a bit further in terms of the potential of Teams and Office 365 for you. We've also got Martin Perry and Rob Gray. Martin, please forgive me, I've just noticed that I've missed your name off the introduction agenda slide, so I apologize profusely. But they're going to give a bit about, they're from Midlands Foundation NHS Trust. They're going to talk about their Teams journey and the work we've done with them with our One Consultation platform. And then I will talk briefly about our Teams lifecycle management, how you can continue the momentum and integrate Teams with your existing workflows, and then a summary at the end. So I will pause for questions at points throughout, and there will be time at the end if anyone has any questions, so feel free to put them in the chat, and we'll try to get to them as quickly as possible, and I will reply to any questions that we don't answer. I will come back to you after the webinar here. So that's enough from me. I'll stop talking, and without further ado, I will hand over to Gavin Dyer to give an introduction to Modality. So Gavin, over to you.
Thanks, Tom. Good morning, everyone. So I'm going to provide just a quick update as to who Modality are and what we do. So as an organization, we are 14 years old. And ever since we started out on this journey, we've been a Microsoft partner. Today, we are the world's largest dedicated independent Microsoft Teams practice. We've won Partner of the Year 5 times. And our focus is really to ensure that you get the best value out of your Microsoft investment. To achieve that, we've really made sure that we can deliver where it counts. And our whole organization is geared towards helping you leverage Microsoft Teams and Microsoft investments to the best possible ability. We have a lot of strength in depth when it comes to consultants, and we're able to deliver a wide range of different services and products. So if we could move on to the next slide, please, Tom. So where are we able to help an organization with their Microsoft, on their Microsoft journey? Well, it starts out with our consulting practice. We have strength and depth and the ability to deliver a broad range of workshops to help you with your planning and your strategy. When it comes to the implementation and change that may need to be implemented within your organization, we have the skills and the expertise to take you on that journey through those sort of traditional consulting type engagements. But that's not where we stop. We have our own in-house software development team based in the UK, and we will look to develop software products and services that can complement your Microsoft investment. So where there are gaps or white space between what Microsoft can deliver and what the customer requires, we look to fill those areas with our products and services. And the examples of that are teamwork analytics, our custom invite service, one meeting and one consultation, which all provide you with the ability to either track and analyze how your products are being used more effectively, or how you can collaborate more effectively by bringing in other services and solutions such as video conferencing, video consultations into your team's environment. And then we also work with a select number of third-party software providers who also provide complementary services to that Microsoft ecosystem. We can assist you with call center, contact center, call recording, access and security services as well. And then to put a complete wrap around our proposition, we run and operate a 24/7 support and help desk. And out of that team, we're able to deliver a wide range of managed services to help you support and run and operate your current environment. We can also provide a full suite of break fix and support services as well. So really, it's a cradle to grave type service offering that Modality are able to provide, from that simple consulting engagement all the way through to that managed service wrap. We can tailor our services and solutions to meet your specific requirements. One size isn't always fit all, so we tend to adopt a consultative approach to try and ensure that we can help you achieve the most out of your investments. So hopefully that's given you a short overview. I don't want to take too much time today to delve into where we can help you, but I'll hand over to Keith now, who can give you the overview of the Microsoft services.
Thanks, Gavin. And if I can just ask for my slides to be transferred, is that, Linda, is that something that you'll do, or do I need to do that now? There we go. There we go. So hi, I'm Keith Hanna. I'm part of the Teams engineering group in Microsoft, and I'm really responsible for the use of Teams in healthcare across Europe. So some of that is talking to you about what our vision for Teams is, what's going to evolve over the next sort of 6 months. And then further afield, I work with customers and partners to evolve that story from 6 to 12 months based on your feedback. So today I'm really going to be talking about how we see Teams move. We are currently in this scenario where it's very reactive. We feel sick, we see a doctor, we go to hospital, we give in our information, we get assessed, we get whatever treatment's necessary, we recover and we repeat. And this is just a continual cycle. And to be fair, it doesn't just apply in healthcare. This is how we often work. We want to move into the proactive sense here, where actually we get preventative medicine, preventative treatment ahead of time. It's all about, the message is 5 a day, keep fit, keep healthy. Ultimately, that puts less stress on our, in the UK, in the health environment, but also on ourselves, and also has the added effect of saving money all the way along that journey. Prevention is much better than cure. We've all heard that before, I'm sure. So what we see happening as health evolves, we're moving from this systems of record type concept where we have the data, and whenever we need the data, we go and look at the data and then respond to what we have. So we'll have our patient records in our sense there. And as we're sick, as we see the doctor, those are updated, and they're just factual. That's all we have. Moving into systems of insight, this is where we start to collate that data and see that where somebody has been sick before and got better, maybe that is useful for other scenarios or similar scenarios, other patients, or nationally, as we're starting to see across the sort of COVID response and how we're getting that feedback. All the way through to the systems of engagement, where really this is where we want to move into the preventative maintenance, as it were, but patient-led care is another phrase for this, where the patient is actually part of that care journey in partnership with medical staff. So how we do this and how we see this coming, and where Teams really helps, is Teams really can be thought of as the engagement hub, as we say here, or some customers refer to it as the new desktop. So the idea behind Teams is it's evolved from our legacy products of Link and Skype and OCS, for those of you that remember that far back, but it's all around the chats, the calls, and the meetings. That's our bread and butter. We've been doing that for years across the Microsoft suite. But what Teams brings is this collaboration aspect, how we can co-author, we can work on documents together, we can share our content, we can capture content, and trigger automation of that. And then the analytics off the back of it is that systems of insight, where we can start to drive feedback. Now, this is obviously showing the Microsoft Office 365 platform, but once we start to look wider than that, we can connect into other systems. So we use Azure, again, the Microsoft platform, to do this. We're not limited to Azure. We can use other cloud services, but this is where we will connect and bring that data into Teams and surface it into those analytics. Patient record systems is a good example here, using the FHIR connectivity. We can use the standards-based methods to bring collaboration into patient records. And then wider than that, we have our Dynamics platform, where we have some of this capability. It's more generic, but customer service, if we think of that as our patient is the customer that we're dealing with in healthcare, we can start to leverage some of the wider enterprise resource and customer resource management capability from Dynamics to actually manage patients. And we have a number of partners who've developed, using our healthcare accelerator capability, patient management systems based on Dynamics. So we see a lot of growth around there. So in terms of the Teams, the sort of 4 pillars of Teams, we have our communications, I've mentioned, through the chat, meetings, and calls that we've historically provided in other products. But collaboration is really where we see the benefits of Teams. The differentiator from Teams is this: we're highlighting here a file. We're looking at this Excel file. We're in a channel. We're all working together on it. That equally could be a patient data connecting to the patient record system. And that's where this customization and extension comes in. Teams is a platform, it has a store, a bit like Apple and Google have their iOS store and the Play Store. There are partners out here who create apps. You can create your own apps and publish them for your internal organizations. I do a lot of work across the NHS in particular about building apps using the Microsoft Power Platform and providing that capability just to your own internal staff. And then finally, it's built on the wider Office 365. So we have the confidence, the security aspects and capabilities there. So how does this look from a health provider perspective? So if we look at the sort of healthcare architecture in an organization, we have these sort of five sections. On the left, we have our medical records. That's where the privacy rules apply, the HIPAA, GDPR, that sort of capability. That's the patient data. We're not looking at accessing or manipulating that directly in Teams. We use Teams as the sort of way into that and enable us to surface and collaborate around it. It's these pillars of communication, care management, and processes where Teams has a direct capability of playing. My graphics don't look very good in this slide, but this is where we see Teams. The chat and the calling is very sort of obvious here, and where we have our meetings, the virtual or physical MDTs that are going on, but the wider Teams, the ability to alert on messages and escalate, the ability to generate automated processes of the wider platform behind Teams is where we can start to see lots of value coming. So if we look at where this goes from a products perspective, and some potential products here, Teams is taking over that section as I mentioned, but where we hook into, we recently announced collaboration with Epic to become part of their App Orchard marketplace. So this allows Teams to directly interact with patient data, so we can trigger appointments, we can trigger updates from Epic through Teams and collaboration that way. We also recently announced a collaboration with Nuance, who provide the Dragon Medical platform. So we can capture a recording from a meeting, have Nuance transcribe it from a medical capability, and then submit that into the patient record system, Epic or others. So we start to get that connected process and workflow. So excuse me, what we have here is our build up of the sort of Lego blocks of Teams. We have the core at the bottom. It's built on the secure platform of Office 365, which as a platform complies to a number of privacy regulations across all industries, so that it's not really specific at that point. We have financial services, we have health, government, various regulated industries, and that is the core capability. That's the meetings, the chat I've mentioned. But then when we look at a first-line worker scenario, so this is the people away from their desks. Maybe you have a tablet, maybe you have a mobile device. It's been able to bring that capability and potentially specific capability to those devices and those people where they are. And then beyond that, we start to see the sort of more advanced capabilities where we are talking about the messaging sides of it, notifications, alerting, secure messaging. We'll see some of these screenshots in the next few slides as well. But then at the top, we kind of look at the medical specific environment. So this is the connectivity to the patient records through FHIR to digital imaging systems, the workflow. All these other aspects are what makes Teams aware of health. It's those processes that are health specific. And here we've got some of our scenarios around productivity, clinical operations, and our virtual consults, which we'll hear more about towards the next section of this presentation. But it's where Teams can apply. Again, it's not specifically Teams, but Teams is surfacing that interaction, be it through connectors into knowledge bots, the scheduling capability, being able to dynamically send messages to people who are on a shift versus people who are not on the shift. No more coming in the morning to see all the overnight messages that actually have nothing to do with you because you're on the day shift. We can send messages directly to only the people they're relevant to. And then we go through the likes of operations, our day-to-day process, being able to automate that and present that data back through Teams dashboards in terms of where the status is, quality control processes, our meetings, MDT sessions can all be driven through Teams. And I'll save the virtual consults for the guys later in the call to talk about. So excuse me, some of the features we've built over the last 6 months really. Mobile first, so the ability for the Teams mobile app on Android or iOS, on mobile phones and tablets, to have this capability of adding in apps So the apps are what we use to extend Teams, but also we have controls over those apps from an IT perspective. So we can enable particular apps for particular groups of people. So we can ensure that only those relevant people will get shifts, for example. Read receipts seems very simple. The concept of knowing somebody has got your message, but very important. We can see here in the screenshot, we can see exactly who's read our message, just to make sure that that message is getting through. No more fire and forget. Do we know if they've got the message or do we not? We have our confidence here. Notifications, so we can alert people if it's an urgent message. We can alert every 2 minutes until that's answered, or up to 20 minutes maximum, and then maybe we can trigger some process to alert somebody else, maybe their manager, if they haven't responded. So here we can start to think about scenarios where we're paging people who are maybe on call and we need an urgent response. Secure imaging, so we're from a privacy perspective, we're capturing this image in Teams. It's not being stored on a local device. So even though we're using a phone to capture and send that image and potentially annotate it as well, it's not been stored in the local camera roll, which means it's not been shared on social media. It's not been stored to people's OneDrive or Google Drive or Apple Store, or Apple Drive rather. It's just securely kept within the Teams environment, so we can capture that data direct. Scheduling of shifts. So this is how we can manage and control who receives messages, who's on the shift. This is obviously a retail scenario here with beverages and furniture departments being managed, but equally this could be any other shift-based working organization, and we can target our messages, like I say. Following into that, we can also do time management. So we have the ability to track. Oh, sorry. We have the ability for people to try check in and check out whenever they're on shift or not. Also, one of the features around this is we can make sure they're actually in our location, so in the building. We can tie things down to make sure that we're not getting people checking in from home when they're not actually on premises or working. We can tag people by skill or by roles in this case, so we have the ability to group people together and just alert to particular groups of people, slightly different from the shift scenario, where we're alerting people who are particularly on shift. This one is will send to all those roles. We just have a walkthrough here, so we can tag people based on these groups. And only those people are going to get those notifications. And then some of the things I wanted to highlight that are coming really in the next few weeks or months. Some of it we've already seen sort of in the press. Together mode reduces our meeting fatigue. So instead of everybody just appearing as a little square with our webcams, we can appear together in a different sort of background. The first one that we've released is the auditorium, but we're starting to release a few more options on that, which will allow smaller groups to work in maybe a coffee shop type scenario. Dynamic view and large gallery view both work together in that they will expand and modify the layout based on the number of people who are actually in a meeting. So we can go as far up to 49 people in a single view there. Virtual breakout rooms, massive demands, primarily from education, but the idea that we can be in a group session, then we can split people out into subgroups to work on a project and come back. A lot of health organizations and trusts across the NHS are definitely asking for that as well. And then we start to go into more interactive capability in the meeting, being able to send reactions. You know, we're doing well, we're going too fast, too slow type through the PowerPoint as we go. Chat bubbles is an interesting one where actually we've found our feedback is people forget about chat in a meeting. So the chat bubbles concept brings the chat to the front of the meeting, to the top of the screen. So there's no more trying to hunt and find that particular message that somebody has sent or question. Live captions and transcripts is coming. I mentioned the nuance integration. We'll start to see language expansion come over the next few months as well, across particularly the European sort of languages. And then we'll start to see a lot of expansion around device capability. So that'll be meeting rooms or individual personal devices as well as voice recognition, so we can actually talk to Teams and get it to carry out some tasks. And then the final thing I wanted to leave you with was this is the stats released, I think it was last week, by NHS Digital, where in the NHSmail tenant, so the central tenant for NHS, not all trusts are part of that tenant, but in that tenant alone, we've seen over 13 million meetings since the start of the COVID response. Almost 64 million chat messages. We see weekly almost 4 million chat messages a week. All organisations in the NHS are enabled, so we've over 1.3 million users there, and we see lots of calls coming. And those are just internal calls. They aren't even, before we even start to look at calls to patients externally, we've seen 2.5 million calls almost. So there's massive uptake across the NHS, which is great to see. And I will hand it back to, I think it's Tom is up next, but we'll hand it back to Tom and we can talk about more of how we can help to see that uptake increase.
Perfect. Thank you so much for that, Keith. That's it's always fascinating to see all the different possibilities with Teams, the services that are coming as well, and just I guess it just highlights the possibilities with Microsoft Teams. I'm just going to share out my desktop again with you. There we are. You can already see us. You don't need to see us twice. So the next section of the webinar, very briefly, is just about some of the work that we're doing in healthcare modality, and then the next section is going to be then what we've some of the services we have to wrap around this. As Gavin said, we have our a development team at Modality, so we build out our own software to complement our services within the consulting services within Teams. I will talk briefly about the lifecycle management Gavin alluded to and some integration challenges. But I'd like to hand over now to Martin Perry and Rob Gray from Midlands Partnership NHS Trust. By way of an introduction, Modality have been working with Midlands NHS since March, when we worked to deploy our One Consultation service, which is a virtual consultation platform, which enabled them to deploy our service to use Teams to effectively continue delivering virtual consultations with patients when people had to work from home. So I will not take any more of their airtime. Gentlemen, I'll hand over to you. Again, I will try to judge when your slides move, but if I get it wrong, feel free to shout at me and tell me to jump on one.
Thanks, Tom. So good morning, everyone. So as Tom said, we've been working with Modality since March in earnest, but actually slightly before March, where we had a demo environment established on the One Consultation platform. And that was really a key driver for enabling us to rapidly deploy the platform in March when push came to shove. So in March 13th, just by way of context, it was a Friday the 13th, so that should have been a clue as to what was to come. We had an emergency COVID planning meeting with our partners who are the Health Informatics Service, that are a shared partnership of IT support across Staffordshire and Stoke-on-Trent and Shropshire. And they are responsible for managing the infrastructure and allocation of Microsoft licenses. But on that March the 13th, Midlands Partnership Foundation Trust had not done a single virtual consultation, and we'd done very few webinars, virtual meetings. We used Skype for Business on premise, and we were just not adopters. We were green when it came to this. Very quickly, we had to become experts, as you'll all be aware. So by the Sunday, the 15th of March, just evidencing how green we were, this is an email on the screen to my executive team and the heads of operations to say, hi everyone, we've got a bit of a demo environment here that we could use for virtual consultations. From the headlines, it might prove pretty useful in the coming weeks and months. Here's a little video, which is a video that I did on the demo environment with myself and my wife at home on a Sunday evening, and edited it and shared it with the exec team just to demonstrate how it might work in practice across the organisation. It's a rubbish video, but it got the message across, and they looked at it and went, yep, we absolutely need that. Do what you can. On the 16th of March, thanks to our Microsoft account management team, we and the national deal, we got an allocation of E1 licenses to cover our 9,000 user accounts within the organisation. As I said, we were green. We didn't have any Office 365 licensing in the organisation. So thanks to the deal on the 16th of March, we deployed Microsoft Teams at scale across the organisation overnight. What we did there to rapidly deploy that, which is on the next slide, is we took risks. We didn't hold back. We looked at how we could do it as structured as we can, but at pace. So we used clever little ideas like aligning our Teams channels with the SR teams. So that way we could deploy it and it would be good enough. We didn't expose the organization to be able to create their own team channels in earnest by default. We tried to control it so it wasn't an uncontrollable environment. So it's controlled and managed as best as it could be, but in a really short time frame. So as I say, from the 13th of March, having done 0 meetings whatsoever, and on Keith's slide, we're not in that, we're actually on our own tenant. So we probably double those numbers with MPFT stats. Joking, but we would contribute to them. We've got this Teams application deployed. We're telling staff how to use it on their smartphones, using personal devices, because all of a sudden we're going to have to mobilize our workforce to work from home. We've got community services in 150 network sites up and down the country, and this is new to staff. So how did we do it? Well, we did it with close collaboration, firstly with Microsoft, the HIS, and Modality. So that video showed a one consultation link through to Skype for Business, which carried the consultation in the early days. We then got that working with Microsoft Teams as per Keith's slides in this session. And really that was instrumental to enabling us to rapidly deploy 180 unique waiting rooms across all 4 care groups that we've got in the organisation. So we do learning disability services, mental health services, physical community health services as well, as drug and alcohol services. So we cover a lot of areas of healthcare and social care within the organisation. So we needed a good enough solution to cover all of those areas very quickly. So 180 unique waiting rooms was done through close collaboration with Modality. And that was a key to how we rapidly deployed it as well. If we were to do this on the standard monthly project meeting, we'd still be here talking about it today and not actually doing it. We had weekly, sometimes daily stand-ups to try and get this up and running, and it worked fantastically, to the point where we've able to rapidly scale up our virtual consultations when it was needed most, which Rob will tell you about in the information. Just certain areas that we've done which was of interest. So where there were limitations in both the existing functionality of the product and Microsoft Teams, we did in healthcare, which is called a standard operating procedure. And we sopped our way around it, is what I tend to say. And that's a demonstration of what's on here at the minute. So rather than not doing anything due to the fact that the functionality isn't quite as where we need it to be, we ensured that we were compliant. We've got our personal identifiable data controlled, and we've got SOPs in place to advise staff how to work around some of the limitations of functionality at that point. So a key enabler for us in lieu of group therapy sessions functionality within the one consultation platform at the start of the pandemic, we were using Microsoft Teams in earnest for group therapy sessions, but we did SOPs to ensure that clinicians are inviting people with BCC fields and ensuring that the patients were advised to join as guests to withhold their private information. So that's where we're talking about SOPs being used to enable us to continue deploying and using the technology that was needed most, but without sitting and waiting for the perfect solution, which Keith has articulated and which Modality have been working on with us as well. So all of the bureaucratic and slow processes within the NHS were undertaken, but they were done at pace, and we expedited all of those. So the contractuals, we turned the contractual arrangements around, the DPIA, GPR compliance, and ensured that everything was ticked, but in record speed, in order to enable us to roll this out at pace. So the final thing around the rapid deployment on the next slide is the training and the support. So we have what's called digital champions within the organisation, and they are clinicians and carers that have a vested interest in the enablement of digital technology. So at the minute, the culture should be that's everyone. Obviously, it's not. There are still people out there that hate technology, myself included some days. But we have the digital champions that work closely with us, and they were instrumental in enabling us to beta test some of these products, champion them when they were up and running, and then further deploy them and embed them. So essentially, with the digital champions, we've had 250 trainers essentially in the organisation, and comms champions too. Another element which was instrumental was the communications, the quick reference guides. We did useful YouTube videos. Our training team said, hi, this is how to do it. This is how my smartphone works. This is the tips and tricks to look out for. And we published these really quick, sharp, smart, short videos, sent them out to our workforce so that they could get on and use the platform with some confidence without needing to wait for the service desk to pick up the phone. And that image there is just a brief example of the kind of comms we were sending out during the pandemic around what to use and when, and teams with caution at the time. So Keith's comments and the slides are useful for how we can turn that to approved in the future. But during the pandemic, it was with caution, follow these SOPs, click here, look at these videos, and for staff approved, go for it, talk to each other. One consultation for patients, go for it. For staff, avoid it, keep it for the patients, use Teams to do staff to staff. So those videos, those guides, those comms were instrumental as well to onboarding this at scale. So it's over to Rob to talk about how we've used the information reporting and the BI platforms to then further inform that rollout.
I want to start with this slide, just sort of splash some stats at you. This, looking back, you can see the trending of how we massively increased our usage in the early days. Now, and that training that Marty showed you definitely helped in that respect. But as people were adopting to the environment of COVID and shutting down face-to-face sessions and moving to a new way of working for this, you can see that the uptake increased exponentially in those first few weeks. Initially, the information that was coming back, we were just sort of keeping a running count of all the sessions that had been run, and eventually we moved on to this kind of trending graph. As you can see, 37,000 sessions in 6 months is, from a zero start, is not insignificant. And it settled down into kind of an average. I think it peaked at about 1,200 sessions a week, but settled down to an average of about 1,000. And these are 45-minute sessions on average, some up to sort of 3 or 4 hours long in some cases where the need has arisen. Also, from this trending graph, you can see it's obvious the weeks that have a bank holiday in them, you get a slight dip, taking away 20% of your usage, and coinciding with half term, so you have staff off for that week generally. Also, you see that peak over July and down again. That was where COVID was starting to back down a bit, and some face-to-face sessions were being reintroduced on a trial basis. But the usage of digital sessions was still massive, because it was adopted and it was useful, and the benefits were clear. Going on to the next slide. The reporting initially provided by Modality was a Power BI interface published by them. So to access this, we needed some Power BI licenses. These started off as, I think, 60-day trials, but it increased our knowledge of Power BI as an organisation and the kind of the usefulness of it, but it also limited the access to the information to certain sets of staff that were able to navigate it. So one of the challenges we had to overcome was getting this information back into our organisation and publishing it to the people that needed. And the information that was there, it's developed over time. And to start with, any information was always a good thing, and it did focus on the quality of reports. So quickly on to the next slide. I'm trying to sort of catch up the pace. Yes, our knowledge of Power BI increased as we went, and the more information we started providing, the more information people wanted to find out a bit more about, keep track of how this was being used and what use it was, and where there was any actions that needed to be taken. So we took that, we tried some things out, and that kind of trending report, which wasn't available early, and working with Modality, this has now been available on their Power BI dashboard directly from them. And we grouped rooms, and because we had 180 of them, tracking 180 individual rooms wasn't ideal, so we've had to sort of do that ourselves for the moment, to give those care groups a little bit more information, sort of focus particularly on them. Other challenges on the next slide. The general public, it's kind of like having an extra 40,000-50,000 members of staff that you can't force to look at the videos you provide and take the training. So we're relying on them being able to, first time, be able to join a Teams meeting almost without having experienced one before. And public being the public, they've got devices from the 80s sometimes, and you can't rely on them having the latest version of things to be able to connect. So you can't assume anything like that. And their levels of digital literacy varies. And coping with all of that type of stuff, I think has gone remarkably well. The clinicians, being the only people in touch with our patients, almost had to become first-line help desk, solve them and guide them through those connections, and almost train them in some ways. With a phone, oh no, press this button, do that, and they did remarkably well as well. So getting 1,000 sessions a week in that kind of environment has been a big accomplishment for them. Equality impact can't be underemphasized, and as you can see, we've got cameras on at the moment because we found that our hearing impaired service users and staff really appreciate having a video feed to help them out in those circumstances. The vision, auto transcription that Keith mentioned coming up on the screen is a huge benefit for hearing impaired staff and service users as well, and that would be a great thing for us to be working towards. The limited Teams features available. We've given all our staff access to Teams, and they've adopted it really quickly, massively, and you can see the number of meetings that Keith mentioned. Sometimes I feel like I've attended most of them, but staff ramp up the use of Teams, and they like all the features, and now they want them everywhere. It's nice, but it's also a challenge when they want everything in their clinical consultations as well. Screen sharing and session recording have been the most requested things. Screen sharing, which you can now do, but session recording, again, it now trips over the IG type stuff, so that's a challenge we've still got to solution for. On to the next one. Moving forward, group sessions. Modality now for group sessions, which is great. We've been trialing them with specialty services, 6 to 10 people in each, and it's going really well. They love it. We want to expand on that a little bit, which is all good. And now that we've got an agreement now to roll out E3 license for all our staff, a bit more functionality for them all to move up from their E1s, and just really embed Office 365 Microsoft and that collection of products, as Keith mentioned, into the longer term. Next slide. Yeah, some actual feedback from actual users is always nice to have. I'll let you read it in the recording if you don't get the chance to see this. And the service users themselves are what we, everything we do is focused around. So getting some feedback from them about how much this has benefited them and made consultations possible in a COVID environment where we're minimizing face-to-face has been a lifesaver. Sometimes literally, I'm sure. Any questions? Are we taking questions, Tom?
If there are any questions, well, firstly, thank you so much for that presentation, Martin and Rob. If anyone has any questions, please feel free to post them in the chat, or questions for those. We'll pause at the end for a couple of minutes to take questions there.
Okay, thank you very much.
Thank you, Rob. And I think just a quick note from me that the technology is only one element of this. Being able to provide a virtual consultation platform that works when we test it in IT with a customer is only the start of this. I think what Martin and Rob have both spoken to, and where Midlands have been a great example for this, is just the effort and the wraparound involved to not only deploy it to people and to get people using, but realizing that you know what, it's not going to meet everybody's needs first time. There's got to be some flexibility, and the way that challenge was approached in terms of how do we work around this, what can we do to fill the gaps whilst modality one consultation catch up and the Microsoft functionality arrives, has been amazing to see, and a real testament to those guys. And the stats shared there just show the success of that. Moving on. The last section from me, and I will keep this brief. I'm conscious we're just about to run over time, so thank you all very much for your patience and sticking with us. I just like to talk about our teamwork analytics service and our one meeting service. So I think it's fair to say that Teams is here to stay, and I've put this slide up now. I won't talk through all of it, and this will be shared with you, but ultimately the challenges, or the question that I like to ask, is what's the worst that could happen? So as we've said, so much of all the benefits and all the great stuff that people can do from everybody here, so not meaning to bring it down on anything, but to focus now from an administration point of view of what do we need to worry about, what do we need to be aware of in this new world of cloud-based document sharing that Keith alluded to, self-service, people being able to create teams themselves. How do we control this, and what are the risks of it? The risk is ultimately that if you let teams get out of control and sprawl, then there could be things like the confusion amongst users. What's the best way to do things? What's the difference between a group chat and a team, for example? You know, there'll be lack of discipline in terms of team creation, people using it for really in-depth teams, for customer-facing teams, for example, and services, through everything through to lunch plans, for example. Now, none of that is wrong, it's all collaboration, but what guidance can you give people to make sure that they use the right thing in Teams to do the right sort of conversation? And those two elements, then you run the risk of losing control, with every user taking a different approach, with no visibility of which teams are active. People then start reverting to previous ways of working, and you really don't see the benefit of Teams. And the big risk, and Keith alluded to it, around the GDPR and the HIPAA compliance and the ISO compliancy, there's a hidden risk there with people sharing data and putting that data in the cloud and all collaborating on it. So ultimately, as an administrator, how do you have visibility of that, and how do you control it? At Modality, we have our Teamwork Analytics service, which is a lifecycle management solution, and we focus on the user each step of the way. I won't read the full mission statement out there. Essentially, it's an idea that from the time a team is created to the time that it is not being used, we monitor that, we visualize that information, and we help you keep that team in track, in control, and really keep it relevant to people. We do this within Teamwork Analytics. We have our Create Team module, a series of reports, and some automated bots. The Create Team module is a Teams app that allows you to, you can roll this out to everybody, and it allows you to control how people create teams. You can create templates whereby you can have different workflows, such as some teams need to be approved by an IT administrator, but you know, some teams don't if they comply to all of our best practices. We give control regarding governance and personal identifiable information. So if you're adding guests into a team, you can use Create Team to say only certain users can do that. So it allows you to enable that guest functionality, but control it as well to stop the potential of either every team having a guest in it or being able to have guests in it, or locking it down completely. So users then have to jump through hoops to get it enabled, and it's not really going to have those same self-service and adoption benefits we see at the moment. And we can also use Create Team to apply things like retention labels, and we're looking at, and we do a lot of duplicate team checks as well to suggest similar sounding teams, and also ensuring that naming conventions are applied as well. And then those rules that we set within Create Team can then be tracked through our governance and usage reports. So these are reports hosted in Power BI that allow you then to monitor your whole team's creation, your team's infrastructure, giving you areas to concern through a traffic light system. Obviously, green being all good, through to red where this is something you need to you draw your attention to. Gives you visibility of guest access and the activity and from where those guests are joining, and you can really drill down into a very granular level for those teams. So that is the Teams lifecycle service, and we wrap that with a consultancy service as well to really help get in depth and drive that data, and hope to keep everything under control so that you can realize the benefits and the use cases that we've already spoken to. And the final service and challenge that we've seen with Teams is, and Keith spoke about the integration piece, and this is integration around the video conferencing side of it. So one of the undoubted successes of Teams is the uptake in video conferencing and using Teams virtual meetings, but how do you keep that momentum when, and hopefully when rather than if, people return to the office? So people are still going to want to use Teams meetings when offices and practices open, but the key is then offering that flexible blended approach of still being able to realize the benefits of working remotely, but also the benefits then of working with people in the office. So integrating those existing video conferencing rooms into your Teams world so that they can now join Teams meetings. Keeping Teams as the platform that you have all your video conferencing on, and then using your existing meeting rooms that you've got before Teams to join those meetings. One Meeting is an interop service. It's a fully hosted CBI interop service for Teams that's quick to deploy, and it's fully customizable for you. One example of this, and there's lots more, but the one that we've come across is, again, the switch of multidisciplinary meetings to Teams, for example. So before Teams, these may have been conducted using traditional in-room video conferencing systems, one in each practice or each hospital, and you have clinicians and teams joining a meeting from all different trusts via that video conferencing link. With Teams, that could be now delivered as a Teams meeting. So if this is hosted on Teams, with One Meeting, people can still join those meetings from Teams as they have been working remotely, but they can also join them from those video conferencing rooms as they did before. So it's really giving you the best of both worlds, keeping that benefit you've seen with the flexibility of Teams, and also the realizing and still getting the benefit of working together in offices in person with that technology that you may have an investment in. So that was our One Meeting and our Teamwork Analytics service. That was a very brief overview of them, but hopefully gives you an idea of some of the areas we're working to enable you to see the benefits that Keith spoke about, and then hopefully move as quickly as Midlands has done, and see the success that they've had with their team's deployment. Again, these slides will be taken out. In the interest of time, I'm just going to skip over those for the time being. So just before answering a couple of questions I can see that we've had come through in the chat, I think we can all agree that Teams, there are huge benefits for it. There's huge potential for it, but without the necessary policies and control of Teams, then sprawl can occur. The easiest or the quickest thing to liken it to is how many WhatsApp groups are you part of? You know, you have you create a chat for WhatsApp, you use it, it gets put to the side. WhatsApp is adopted so much because it's easy to use. Teams is the same, but you need to be able to control it to prevent that happening. The key ingredients we see for success at Modality are the governance piece. Make sure that it doesn't sprawl, and make sure that everybody is confident in the security of the data and the way they're working and consistent, and also ensure that any return to the office goes smoothly, so that the momentum we've seen with Teams doesn't get lost and doesn't get forgotten about, and people don't revert to old ways of working following going back to the office. Final piece, we offer a free of charge trial for all of our Teamwork Analytics, One Meeting and One Consultation services. More information is available on our website at www.modalitysystems.com. I will pause there, and I will just look to answer a couple of the questions that I've seen come in. And it's a question for Rob here. Sorry, Rob, I didn't brief you. We do a Q&A, but someone's written for Rob on it, so I'm forced with no choice. But they're asked, are you currently using breakout rooms? So our community teams are using group sessions as well, and are keen to get this up and running.
I think as Martin's answered in that chat, we use there's a workaround in Teams until their breakout room functionality becomes widely available, which we're very keen on. There's a workaround where you essentially create separate team rooms at team appointments ahead of time, and put those links into the main meeting itself and send people out. We've been using that with some success, but very keen for the team to meet group sessions, the breakout rooms to be functional.
Perfect. Thank you. Thank you very much, Rob, for that. And I've just seen Martin's replied in the chat as well. And thank you for that. And the final one was, would there be a demo in this session? I haven't got time in this session to do a demo, but if there is one that you would like to see of any of our software, please let us know. We can reach out, we can get something set up, and can go through it in more detail there. That was everything from me. Just final thank you very much to all of our presenters, to Gavin, Keith, Martin and Rob. Thank you so much for contributing. It was really fascinating. I hope all of that information was useful to you guys who've joined, and we'll follow this up with an email with the link to the recording and the presentations given today. But remains for me to say thank you so much for joining. Have a great rest of the day, and we will see you all later.
Thanks, everyone.